Hi, I'm Dr. Waples, the founder and medical director of Restore Medical Spa. And in this video, we're going to be talking a little bit about how you can choose the right treatment for your under eye area. And this is an area which tends to be one of the first places that we show our age. And very frequently, people will come into me and say, I look tired, I look hollow, I have these dark circles or bags under my eyes. This is an area where those signs of aging start to become apparent, maybe before they become apparent in the rest of our faces. There are many different tools that we can use to help the appearance of the under eye area. And which tool is right for you really depends on what's causing those changes that you see. Now, if you want something that's totally personalized to you, you should come into Restore Medical Spa. We'll build you a care plan. We'll tell you exactly what steps you should take to rejuvenate your under eye area. But if you want some general rules of thumb, here they are. Aging around the eye can be caused by basically four different things. The muscles that we contract when we smile cause diagonal lines. So if you look underneath your eye, what you see is these kind of curving diagonal lines that look like hockey pucks that then merge with the crow's feet over here. Those lines are going to be solved with muscle relaxation. Botox or Dysport will do a beautiful job with those. If you look at your eye and see that the skin is the same color throughout, but there's almost a divot or a hollow underneath, which is a very common appearance of aging, that's part of aging is going to be helped by dermal fillers. We put the filler underneath the skin, we lift up that hollow, and the haggard appearance, the darkness all goes away, because that darkness is caused by shadowing from a contour change. Now, if you look at underneath your eye, and it's actually a difference in skin color, that's a much more difficult solution. Sometimes there are lasers that can help, sometimes there are topicals that can help, but fillers aren't necessarily going to help that, because if the darkness is caused by a shadow, you support the skin, there's no more shadowing. But if the darkness underneath the eye is caused by actual staining of the skin itself, very different situation. The last thing that can cause hollowing under the eyes or shadowing or aging underneath the eye is actual bagging of the skin. So when you look underneath the eye, sometimes what you see is not that there's a hollow place, but instead that the skin right underneath the eye has started to pooch forward, if you will. It started to just push out from where your orbital rim, medical term, sorry, it starts to push out from your eye socket. And that is something that is actually very, very difficult to fix non-invasively, because that's actually a sign that some of the fat underneath your eye is starting to come forward, and that usually requires surgery, because here in the non-invasive world, we can add, we're not very good at subtracting. So those are kind of some guidelines for what you can look at in terms of what is causing the aging appearance of your eye. But if you really want an expert opinion, come into Restore, have a consult, we'll give you a care plan, and we'll tell you exactly what we think.